Here at home, the Biden administration is trying to ramp up coronavirus testing. White House health officials announced a new contract today for 8.5 million at-home rapid response tests from a company called Ellume. The test will not require a prescription and can be used on children and asymptomatic cases. ABC News contributor Dr. Todd Ellerin joins us now with more. Dr. Ellerin, this sounds like great news, but we've heard about at-home testing before, and it seems to never quite be the reality that it seems.
Yes, good afternoon, Diane. You're right. I mean, this at-home testing is really critical. We need rapid, inexpensive, accurate tests. They don't have to be perfect, but we have to be able to perform them not just at one time. So why is it so important? Because you just heard James talk about that transmission being uncontrolled leads to more of these variants, and these variants are more contagious, and it becomes circular, that we're just going to see more cases. So if we can test at home and allow people who are infected to stay at home, then that's going to really decrease overall transmission, and ultimately that will also help decrease these variants.
Now, we also learned today that the government reportedly does not have race and ethnicity data for nearly half of the vaccinations. Now, given the stress on trying to ensure an equitable vaccination program, how big of an issue do you think this is?
Well, this is a very big deal. We need better health data surveillance to shed light on racial disparities. Why? I mean, it's obvious. Racial minorities, blacks, Hispanics are dying 2 to 3 times more commonly than whites are, for example. This virus is not affecting all of us equally. So it's really important that we understand this. I've said this before as far as sequencing around the world. We can't monitor what we don't measure. So this is another example where we have to measure and make sure that these vaccines are being rolled out in an equitable fashion.
And one big issue is mistrust in the vaccine, especially still since it's new. So what kind of disinformation are you seeing out there, and what concerns you?
Yeah, wow, this really hits close to home. So with vaccine disinformation, I think there's 2 ways we can try to really attack this in a sense. One is through promoting truth. The other is dispelling myths. I think promoting truth is easier and less exhausting, but I'm going to try to do both right now. So first, dispelling myths. So what we're hearing is that people are dying after they receive the COVID vaccine, that the COVID vaccine is killing people. That is absolutely a myth. That is disinformation. Remember, the COVID-19 vaccine greatly reduces severe infection, and we know that severe COVID-19 reduces death. So the COVID-19 vaccine can reduce deaths from COVID-19. But remember, the vaccine itself doesn't just prevent death. People are still going to die after they receive the vaccine. If I go out in this snowstorm, get into a motor vehicle accident and die, there are people that are going to tell you that because I got the vaccine 2 weeks ago, I died of the vaccine. That's not true. So people who are sick, elderly, die, but they don't die because of the vaccine. The truth is the vaccine is decreasing the number of cases. We've seen this in our system, and overall we've seen significantly less staff get infected. There's less transmission. That's one example of vaccine disinformation.
All right, and it's so important. Dr. Todd Ellerin, we appreciate you as always, and we will continue to attack those myths with you going forward. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.